So good afternoon, everyone. A warm welcome, ladies and gentlemen, a warm welcome to this exclusive briefing, Clean Air for Health, the urgency to deliver on disease prevention, economic savings through revised clean air standards. Thank you for joining us this afternoon. We appreciate you taking the time. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, an alliance of over 80 members from the health community working for better health through a healthier environment. And HEAL is one of the founding members of the EU Healthy Air Coalition, the coalition which is organizing the exclusive webinar and the briefing here today. The EU Healthy Air Coalition brings together not-for-profit health expert voices in the EU to advocate for clean air and better health for all. The founding members of the EU Healthy Air Coalition are the Standing Committee of European Doctors, the European Cancer Leagues, the European Federation of Allergy and Airways Diseases Patients Associations, the European Lung Foundation, the European Public Health Alliance, the European Respiratory Society, and independent health insurance funds. And why are we gathered here today? To speak to you about the urgency to deliver for health with revised EU clean air standards. Air pollution is the top environmental threat to people's health across the European Union and globally, leading to hundreds of thousands of premature deaths and disease and hundreds of billions of euros in health costs annually. Everyone is vulnerable to the harm from poor air quality, and the level of vulnerability is outside of individual control, as it evolves with age, with health condition, with socio-economic status, and it also very much depends on where people live, study, or work. The burden of disease from air pollution in the European Union is unacceptably high, and it's actually largely preventable. And how so? Through targeted policy measures to urgently prevent air pollution at the source, most of the health and economic impacts of air pollution are preventable, contributing also to much needed climate change mitigation. And we'll hear more about the measures and what's needed in the course of this webinar. On the 24th of April, the European Parliament gave the green light to the provisional agreement on the revision of the EU's Ambient Air Quality Directive, paving the way for the Council for Member States to cast the final vote. Given the level of health and economic urgency on this matter, it is important that the new law is adopted and published without delay in the official journal, and that Member States start implementing and transposing the new directive into national law so that people across the European Union, from the north to the south, from the east to the west, can experience its benefits, the swift and long-lasting benefits that this revised law will bring. To speak about the topic today on Clean Air for Health, I'm pleased that we have three distinguished speakers with us. First, we have Professor Sorana Anderson from the University of Copenhagen and the European Respiratory Society, who will speak to us on synergies with climate action, from health risk multiplier to health benefits. Next, we'll have Mr. Christian Horemans from the Independent Health Insurance Funds, who will speak to us about air quality and quality healthcare systems with a focus on sustainability and inequalities. And last but not least, I'm pleased to have Dominique Hamerlein with us this afternoon, an exceptional patient expert who will share first-hand experience on the effects of real people. There's no escape. Everyone is vulnerable. So without further ado, I'd like to introduce and welcome Professor Sorana Anderson for the first presentation. Thank you, Sorana, and the floor is yours.
Oh, sorry, that is a wrong screen. Just a minute. Thank you very much for inviting me to speak here. And as I prepare my slides, I will just make sure that you can see them clearly.
Yes, we can see them.
Great.
Wonderful.
Yes, so I will speak on the importance of the air pollution action and the synergies with climate, agenda, and health. And in this speech, I will give a quick overview of why air pollution presents major burden to health in Europe, and what are the latest issues in our concern on air pollution and health, how climate change also poses the threat to our health, and then very important synergy between these two issues and the latest research that make us even more concerned in accumulating additional health impacts of air pollution and climate change together. Air pollution presents major burden to health in Europe. As pointed out by Anne, more than 400,000 deaths are due to air pollution. This is really concerning, as we know now that everybody's exposed to air pollution, 97% of European population. And this is one of the main conclusions from recent WHO Global Air Quality Guidelines, the latest update, that has really concluded that air pollution is become bigger concern. The newest knowledge shows us the air pollution is even more harmful than we previously known, according to newest evidence. This has resulted in a significant lowering of the guidelines for air pollution, how low air pollution limits should be to protect us from health, and this has really driven our major points leading to revision of air quality directive. If you go in a little bit more detail, I would like to guide you through some of the latest evidence and all the diseases that are related to air pollution, which will explain why this air pollution results in such a big burden, so many deaths due to air pollution every year. Earlier research on air pollution and lung showed us clearly, since we inhale air and we get pollutants in our lung, that they affect our lung adversely already from before birth and in early childhood. Exposure to air pollution impacts our lung function development. It lowers the optimal growth of lung function, and that puts children already in early age at increased risk of asthma, one of the major burden of disease in children, and impacts immune system in children, increasing the risk of lower respiratory infections, bronchitis, pneumonia, that also present a big burden, many sick days for children. These effects continue through our lifetime and affects lung function development, and later accelerates lung function decline, increasing risk of asthma throughout entire life, also at a late stage in adulthood. It increases risk of COPD and increases risk of pneumonia and other serious infections in elderly with that impact on immune system, as we see in the children. This is quite significant impacts. About 40% of all COPD deaths globally, 30% of lower respiratory infections are due to air pollution, so significant impacts. And just to remind of the recent court case that concluded that a girl died from asthma as the main cause of death was air pollution in London in 2013, showing that these impacts can also result in quite serious outcomes, such as the death of a young child that had severe asthma. So this is really real and significant impact on lung throughout our lifetime. Air pollution reductions matter. Just to point out that the recent study in Sweden, where air pollution is among the lowest in Europe, that even at a low area, improvement in air pollution improves lung function. So better air, bigger lungs. It's an important message that no matter at what level, improvements in air pollution matter for our health. From lungs, air pollution spreads to our cardiovascular system and affects our heart. We see now clearly with enormous evidence the air pollution increases number of major heart diseases, including myocardial infarction, heart failure, stroke, and most recently research showed also that it impacts arrhythmia risk. And this is also quite significant, from 20 to 25% of deaths from ischemic heart disease and stroke globally are due to air pollution. So quite significant portion of heart disease is due to air pollution. And reminded, this is a main cause of death in Europe and global in developed world. Air pollution also induces a systemic inflammation and increases risk of insulin resistance and leads to development diabetes. And this is also now well established, and up to 20% of diabetes mortality could be attributed to air pollution, also significant impact with increasing rates of diabetes worldwide. Another concerning link that we knew for quite a long time is air pollution and cancer. EUHAC, International Agency of Research of Cancer, has already more than 10 years ago in 2013 established that air pollution is carcinogenic to humans with evidence quality 1. And recently, in the last few years, we've seen increasing research on other cancers than lung, liver, breast, bladder, kidney, colorectal, and we'll soon probably see quite convincing evidence that air pollution gives increased risk of number of cancers than just lung, and this is quite significant. And finally, newest research on the brain shows also some concerning developments showing that air pollution from early age impacts children's brain, slowing down and preventing optimal brain development, increasing risk of poor cognitive performance and autism, ADHD diseases. And later in life, air pollution can accelerate cognitive decline related to aging, increasing directly risk of dementia, which is also now well established with a number of international studies that just came out. Air pollution is also linked to Parkinson's disease, and the newest research also shows impact on mental health, on anxiety, depression, and suicide. And we will see for sure many more studies on this area in coming years. Climate change, on the other hand, is an increasing health threat. I guess it's common knowledge to everybody that last couple of years we've seen new breaking records in global warming. Temperatures are breaking all the records. We are now officially beyond 1.5 goal for global warming. And this is, of course, posing large concerns to our health. We've seen a number of these extreme weather events, not just from heat, but for flooding, wildfires, and so on. And pretty much every week we see new ones. 23 was one of the worst years, and 24 will likely be even worse. Europe is warming faster than the rest of the world, almost twice as fast. So impact in Europe will be quite more dramatic. And especially impact of heat waves we have seen now in the recent past years. They are clearly visible to everybody in research or outside research arena, that we see these earlier heat waves, longer heat waves, more intense heat waves, new maximum heat temperature recorded across the Europe. And the effect of temperature on our health has been studied a lot, and we see some projections that from annual number of deaths, about 3,000 in Europe that we had in 2020, we see projection by the end of century this will be more than 10 or 20 times to 65,000 deaths. And this depends, of course, on the scenarios and how well we mitigate the impacts of climate change, but quite significant increases in heat impacts on our health and mortality. Air pollution and climate change are inseparable issues. This was also pointed out by WHO air quality guidelines. We need to tackle both to protect health, since the same emitters of air pollution are also main emitters of greenhouse gases, fossil fuel used for heating and energy production, transportation, agriculture, and so on. So what is really of biggest concerns to us is the new research that shows that impact of air pollution and climate change together cause even stronger concerns, stronger health effects. And this new study, Exhaustion, showed us that deaths caused from air pollution are even multiply on the days when it's really hot weather. So beyond heat causing deaths and air pollution causing deaths, this in mix, which we'll see more and more days in Europe with high temperature and air pollution in the large cities that are affected by air pollution, there will be even more deaths due to air pollution on hot days. We see this across Europe, north and east and south and west. So, and this is really raising concern. With this concern of air pollution and heat together causing even larger health impacts, we know that related to air pollution and increased global warming and sun exposure, we'll see more ozone in our cities. This is clearly related to global warming, so we'll see even higher ozone exposures, and they will also accumulate to this effect of particles and gases and other airway irritants for respiratory health especially. And we also, another very big problem that will cause a much larger fraction of air pollution is wildfire. In Europe, we've seen again 23 one was the worst years, and this will just increase in the century. And you can see below, especially in Eastern Europe and the parts of Europe that are already hardest hit with air pollution problems, and Southeast Europe also has some of the biggest climate change heat-related problems that we'll also see wildfire air pollution related events exacerbate this. Wildfires can be very dramatic. We don't know where they occur and when, but we've seen episode last year in Canada that they can affect large metropolitan areas and many, many people, as in New York and all across northern US. And we've seen even in this short episode, just one simple statistics, number of emergency room admissions for asthma increased a lot, not to mention other health impacts that we will see research coming out soon. So to conclude, we have enormous evidence that air pollution health effects are very strong and they justify immediate action. We have a large burden of air pollution in Europe, which is unacceptable. And we welcome here implementation of new AAQD, which has been voted, as mentioned, in April. And we really welcome and just want to restate today how important is that this is implemented quickly without any delay to contribute to a reduction of air pollution, that this is really a major public health and planetary health opportunity for us. We know that implementing a new AQD soon will prevent a substantial number of air pollution related deaths and new cases of major non-communicable diseases and respiratory infection, as well as improve life of many patients that live with these diseases in Europe. This will also reduce adverse impact of high temperatures, as we've seen, due to higher impacts of air pollution on days with high temperatures. Reducing air pollution will mitigate effects of high temperatures on our health. So this is an important additional point. And finally, by reducing air pollution, we will also reduce accompanying greenhouse emissions from those major air pollution sources, and by that help mitigate climate change and their health impacts on our health, as well as slow global warming, increase in wildfires, ozone formation, and all related effects with this. And with this, I would like to finish and open up for next talk. Thank you.
Thank you very much, Sorana, for giving us the summary of the evidence and also linking air pollution and climate change concerns. Indeed, what is actually by now a large body of evidence. So thank you for summarizing that in 10 minutes. I wanted to offer all participants, if you have any questions on this presentation or also the next two presentations, please put them in the Q&A and we can come to them at the end of this webinar. So I would now like to welcome Mr. Christian Horemans from the Independent Health Insurance Funds to give your presentation on the sustainability and inequalities angles. Over to you, Christian.
Thank you, Anne, for your kind introduction. Good afternoon, everybody. My name is Christian Horemans. I work for the Independent Health Insurance Funds. So we have a double task in Social Security. On one hand, we reimburse medical costs to our members, and we also pay work incapacity benefits for people who can't work because of illness. Second important responsibility we have is being co-manager of the compulsory health insurance. And as a co-manager, we need to keep an eye on the way that money is spent and which costs are made. And that's where we become worried about the impact of air pollution on the cost in the compulsory health insurance. Next slide, please. And we're not alone being worried about the impact of air pollution. In 2020, there was an interesting report published by the World Bank, and they made an estimation of the global health cost of mortality and morbidity caused by exposure to fine particles, air pollution. And there you see the figure. It's 8.1 trillion. So that's a figure with 12 zeros, which is a gigantic amount of money related to health. Next slide, please. There's another report, the sixth assessment report that was published last year from the IPCC, that made a very clear statement, the fact that it's a good investment to invest in air quality improvements. Because sometimes you hear that as a reason not to move in that area, it costs too much money. For sure, you will gain back that money as an economic benefit for people's health from air quality improvements. Next slide, please. So as a health insurance fund, we also have been making some studies as we have a lot of data, health data from our members. And the first study was on the link between air pollution and work incapacity. So there we crossed, on one hand, the data on air pollution in Belgium, and we crossed that with our data on work incapacity. And there we saw a very strong correlation. When there were peaks in the air pollution, there were more people falling into work incapacity for mental disorders. So that means that when there's more air pollution, more people have to stop working and stay at home because they're ill. And here we focused on the mental disorders. This is important information. Why? A country like Belgium, for example, we have over 500,000 people being at home ill. So you have to tackle the origins of the problem. And so air pollution contributes to the fact that people have to stay at home with mental issues. Next slide, please. We made a second study in which we looked at the link between air pollution, green space, and medical care utilization. It's also a study that was published later on as a scientific article. What we did there, we took the data of air quality or air pollution in 20,000 neighborhoods in Belgium, and we crossed that with our data with the visits to the general practitioner, so the GPs. And so we could clearly see, again, a very clear correlation. The higher the concentration of particle matter in the air, the more often people go to their GP. We also tried to estimate the cost of that. And so we took the simulation, what if all Belgians would live in a neighborhood with the lowest concentration of particle matter, air pollution? Well, in that case, we could avoid a total cost of 43 million, of which 37 million normally would be paid by the Social Security, and 6 million would be paid by the patient as a co-payment. So if you could reduce air quality or air pollution to the lowest level just for GP visits, this is the amount you could save. So imagine if you would also calculate this for the use of medicines, emergency visits, and so on. The cost for treating somebody with lung cancer, you get a very high number. Also interesting to mention in this study is that we also looked at the impact of green zones. And there again, we crossed the data on the presence of green zones in neighborhoods with the data on visits to the doctor. And there again, we saw a very strong correlation. As soon as you have over 30% of tree cover in a neighborhood, people go less often to the doctor. So this is important to know that I think Sorana mentioned it very clearly in a presentation. Climate change causes higher temperature. Higher temperature makes the impact of air pollution bigger. So if you have tree cover, it can help to reduce temperature and so on. So everything is linked, basically. Next slide, please. So air pollution has an impact on physical health, mental health. Sometimes it's forgotten that mental health is also very much or bears consequences of air pollution. Medical care utilization, working capacity, and that leads to higher healthcare costs, higher payments of working capacity benefits. And so it touches on the financial sustainability of Social Security. Next slide, please. So a third study that we made and that we're finalizing at this moment is a study on the impact of low emission zones. In Belgium, we have 3 big cities with a low emission zone, being Antwerp, Brussels, and Ghent. And what we did is we looked at the impact of those low emission zones in those cities and compared them with 17 other Belgian cities without low emission zones. And there the result is very clear. It shows that the low emission zone has or makes causes an overall more rapid decrease of the different pollutants if you compare it to the cities without the low emission zones. So it's without a doubt a fact that low emission zones are a good thing to improve air quality in city environment. Next slide, please. Second interesting observation or result of the study is that we see that more deprived neighborhoods in Brussels, because this is figures about Brussels, they bear the heaviest burden of air pollution. If you look to the graph on the left, you will see different lines. The dark red line is the data for more deprived neighborhoods, and the yellow line at the bottom is the data for the, you could say, the rich neighborhoods. So you will see that from the moment that the low emission zones were installed, you see an important decrease of NO2, but you also see that not everybody benefits in the same way. If you see that the most deprived neighborhoods, they're still at a certain level of NO2 concentration, while the richer neighborhoods, you see that they're a much lower level of NO2 concentration. So when you talk about policy to reduce air pollution, you for sure have to add a social policy dimension to it. Next slide. So to conclude, what are the three key messages that I would like to bring to you is, of course, air pollution has a big impact on our physical and mental health. We see that when we analyze our data. It's important to always keep in mind, if you reduce air pollution, you protect the financial sustainability of social security. That's an important financial argument that's important to add in the discussion. And a third key message is that when you develop a policy on air quality, always think of a social and socioeconomic dimension, because not everybody is exposed to the same level of air pollution. Thank you for your attention.
Thank you very much, Christian, for your presentation on highlighting again why from a consideration of the social dimension and also equity, as well as from a economic side, it is really important to have strong clean air measures for health. We've now heard two presentations giving you a lot of evidence. I would now like to turn to our third presentation and welcome Dominic Hammerlein to give us your first-hand account as a person whose health is directly affected by air pollution. Dominic, the floor is yours.
Thank you, Anne. Good afternoon. I'm Dominic Hammerlein. I am a patient expert with severe asthma that's hyper-responsive to air quality. Quality is not something theoretical, but it impacts my life and the lives of many others every day. The problem is not many people are aware that air quality has this big impact on their daily life. I am grateful that I can talk to you about the effect of air quality on patients and citizens. Next slide, please. I'm one of the people who are extremely limited every day due to air quality. There are no days that I'm not impacted in my health, activities, energy, and every part of daily life due to the quality of the air. The advantage of being so hyper-responsive to changes in the air quality that for me, the impact is always there. So many people around me go about their lives with no concept of the danger of just breathing. More awareness and better legislation to improve the ambient air for everyone is needed. We need to work together with more countries to decrease the overall air pollution, as we have seen in the first present. Air does not stay within country borders. And the adoption of the EU Air Quality Directive will also support EU's goals represented in the European Chronic Disease Alliance to combat a rise in chronic diseases in the EU, the leading cause of mortality in Europe, representing 77% of the total burden of disease and full death. Next slide, please. Can we go to the, yeah. Around 2019, when these were my daily medication, I was very frustrated because even all this medication did not help enough or helped me understand why some days I was okay and others I could do nothing. Just breathing takes the energy of running 2 or 3 marathons a day. Looking for answers, one of the looked at was air quality. Slowly I understand that my inability to breathe easy was related to the air pollen levels, humidity, air temperature, and wind direction. I spend a lot of time checking air quality to be able to understand what it does to me and my ability to function or not. Now I take even more medication, but still my is not under control. Next slide, please. I am very lucky. I live in Amsterdam in the Netherlands, a city with a dense system for air quality measuring stations, which can access up-to-date real-life data on my ambient air quality and the levels of the different constituents of the air. Where the measuring stations are placed is important to get good and representative measurements, which also look at the vulnerable groups. It would be good to create advice on where measuring stations should be put or which area need to be looked at in the area. Not just good information is important, but also in explaining what it means. These colored dots don't mean much to the average patient. Making the information available and comprehensible is important and will increase awareness of air quality, not just for people like me, but for everyone. Next slide, please. As I said before, air crosses countries' borders, as does air pollution. A pan-European digital air quality reporting system is needed, but we need to make sure the people understand what is being said and also know what to do themselves. Good communication on the daily threshold, not just on not just ozone, but also PM10, PM2 and 2.5, and ideally PM1, combined with nitrous dioxide, sulfur dioxide, need to be need to become standard in reporting, combined with health-related information and advice. But also black carbon, volatile organic compounds, and others need to be reported. Making it the same all over Europe will make people more aware and able to protect themselves. We have the opportunity and the obligation to make air quality and its effect clear for everyone. And we have the opportunity and the obligation to improve the air quality for everyone as well. Not wait. We need to start now and have a consistent implementation of the laws everywhere and have a reliable system of measuring the air qualities and the way of checking when we are not doing enough. We need to keep pushing and we need to improve the citizens' lives. And we need to support citizens and organizations to challenge the public authorities on their actions. What are they doing the right things? Are the decisions they make really improving air quality? What is the impact of the measures and how to measure the impact, and others informed? The implementations of the laws need to be transparent and clear. We need to keep each other accountable and facilitate the citizens can hold the government accountable, procedures and redress mechanisms. If the government or other organizations are not doing what they should compensation for harmful effect on health is needed. Creating systems where citizens can have access to the relevant information and support in creating the burden of. Thank you for your attention, and let's take better care of all. Oh, next slide, please. Sorry. Thank you for attention, and let's take better care for citizens. This new legislation makes this possible. Thank you.
Thank you very much, Dominique, for being with us today, taking the time and the energy, and for your dedication on sharing your story with us and your testimony, which is so important as we're looking at this revised EU Clean Air Standards, to show that this is a law with direct benefits for people, for their health, improving the lives and the well-being for millions and millions of people across the European Union. With this last intervention, we've come to the end of this webinar today. I don't see any questions in the chat, so we can close the webinar. And I wanted to end our exchange today by highlighting that the three interventions that we've heard today, talking about a range of topics on air pollution and health, showcasing and summarizing the science that we have. And we do have a large body of evidence on how air pollution affects our health, showcasing the link to climate change and the new threat that we are already experiencing from the link of climate change impacts, air pollution to our health, but also the benefits that we could have from clean air action for our health and for climate mitigation and adaptation, to talking about inequalities in air pollution exposure and health impacts, and also talking about the huge costs to our social security, our healthcare systems we currently seeing from the burden of disease from air pollution. And last but not least, we've heard from the patients, from the many across the European Union who are looking to the revision of the EU Ambient Air Quality Directive, to these revised new standards, to make a direct impact in their daily lives. So I think it has become very clear that we need to see continued commitment, and there is a continued urgency to act for cleaner for health. And that means also for member states very much adopting the trilogue deal, the provisional trilogue agreement that was reached on the revised Ambient Air Quality Directive as soon as possible, and then swiftly transposing and implementing the directive. So the benefits, the huge potential that this new revised law has to improve people's life, to save on healthcare costs, and to help the EU in adapting and in mitigating climate change can really be felt and experienced and seen as quickly as possible. But it also goes beyond this directive, as we're at the beginning of a new EU policy cycle. And the members of the EU Healthy Air Coalition would like to underline that health protection and action on clean air for health need to continue to be a priority on the EU's agenda in the next 5 years and beyond. And with that, on behalf of the EU Healthy Air Coalition, I would like to thank our three speakers for taking the time this afternoon. I would like to thank all participants for being with us today. I would also like to thank the Clean Air Fund for the support for the EU Healthy Air Coalition, and wish you all a good rest of the day. Thank you very much for taking the time.